Cath Adams.
Cath Adams. And she is our lovely clinical psychologist. So, anyway, the wonderful Cath Adams will take over.
Just talk amongst yourselves while I get my presentation up. Is that this one? This one? So I'm a clinical psychologist. I've been working in oncology for about 20-something years. And I guess some of you know me, some of you don't. You're the fortunate ones in the room. The people that have seen me speak before might recognise that some of the slides are similar to what they've looked like before, but because my brain doesn't have a brain tumour but it has menopause, I'll talk about completely different things when you see them. So a lot of people would say, you know, I don't need to see a psychologist, I'm not crazy. I've got cancer in my brain, or I'm struggling to help someone that's got cancer in their brain, but, you know, I'm fine with it. And that's true, you know. The work that I do as a clinical psychologist is very different in the oncology setting than it would be in a mental health setting. And it's about recognising that brain cancer is really hard. It hurts our brain, but it also hurts our heart. It's the only cancer that really has a direct impact on who we are as a person, because it's in the bit of our body that we sit. Now, some would argue we sit in our heart, and that's probably a better place to sit, but this is a really direct impact on how we perceive the world, how we interact with other people, and what changes for us can be a really tricky thing to navigate. And so some of the things I want to talk about today are really simple things that we can do to try and help each other through this, because brain cancer is also a cancer that really needs a lot of support, both for the patient and for the people that are around the patient. So why does it change who we are? This is probably the most technical diagram I have. I can't compete with Steve in any way for difficult slides. But all the parts of our brain contribute in different ways to who we are. And just the diagram in the middle, all of the bits that are the same colour are involved in doing the same thing. And so for the yellow bits to talk to each other, because some of them are down in the bottom of the brain, some of them are in the middle of our brain, some of them are towards the back of our brain, there's a whole lot of connection that happens between those bits. So when we have a tumour cut out of our brain, the aim is always to take the tumour out, and as Steve said, do as little damage to the person. But we can't help but do a bit of damage where the tumour was, and we can't help but take out some of the connections between bits of our brain. And so one of the things that happens is that our brain doesn't talk to itself very well. And this is one of the reasons why coping with brain cancer can be so hard. Things are changing, and Steve has pointed out that we haven't made big clinical changes in quite some time, but we are making small changes in understanding the more personalised aspects of the treatment. And we are certainly getting people to stay alive for longer. You know, and when I started back at the Mater in 2000, I think it was, we didn't do that very well at all. Do we fully understand why we're doing it sometimes? No, we don't, which also makes it confusing. And it can be really hard to sit in a room like this and hear the statistics. So I'm not going to talk about them anymore. I'm going to talk about some of the other things that make brain cancer hard. And one of those things is the side effects, which is something that Steve actually mentioned. You know, temozolamide's a great drug. It's a shitty drug at the same time. Okay? It's really difficult to live with some of the side effects, and most people suffer with that. We don't often talk very much about changes to quality of life. And that's one of the hardest things. We expect when we get better from something that we will feel better. Not necessarily the case. Sometimes we're better and we feel dreadful. We've got no energy. We suddenly understand what fatigue means. That it's not just being tired, it's about struggling to think. It's about struggling to do. It's about concentrating on having to lift your head off the pillow. So these side effects can be really difficult and they can affect us all differently. And I'm just going to, Dr. Faye's just arrived, he's such a naughty boy. I'm just going to apologise to all the people. Like, listening to this talk can be difficult as well. So while I'm talking to you, I'm sending hugs as well, okay? Free hugs are available at the end of the session from a distance because, you know, we don't hug people anymore. But these side effects can be debilitating, they can be difficult, they can piss us off, and it adds a huge burden to our life, okay? And sorry, I did forget to announce earlier that I come with a language warning, and if I use language that offends you, I apologise. I worked just long enough in the mental health side to have a potty mouth. So we need to look at how we can care for ourselves and for the others around us, you know, and how we navigate that can be really tricky. Because when our brain isn't working properly, we're often the last people who notice. All right? So there may be some things that we notice straight away that change, but our brain is incredibly good at adapting to loss. So when we break down the connections in our brain, it does this workaround thing. It makes new connections, okay? It's what we call plastic, you know? It's able to connect those yellow bits together again, even though we've taken the superhighway out. So our brain adapts, but the other thing it does is it camouflages what we've lost quite often, and it camouflages it from the person who's carrying the brain around. And this can be one of the biggest areas of conflict, and one of the biggest areas that comes up all the time is driving, because I know I'd still be fine to drive, but we don't know that until we try it, and we can't risk letting people try in case they're not okay. You know, I worked with someone in Sydney who was a very successful QC, and he was actually about to run a very high-profile legal case that's in all of the papers at the moment when he was diagnosed with a brain tumour. So he was taken off the case. Now that was really hard because cognitively he didn't feel too impacted, and he was pretty good. And I saw him a couple of weeks ago, and this case, as I said, is on at the moment. And he said, I did a bad thing. You told me not to go, but I went. And they actually let me sit in on some of the legal discussion. And he said, that was the first time I realised my brain's not working like it used to. Because he couldn't follow some of the higher level conversation, and he couldn't follow 7 different conversations happening at once. You know, that's often one of the things that happens for us is our brain struggles to take in lots of information at the same time. And when we're making those new connections, we make shortcuts. And so sometimes things like being in a noisy place can be really overwhelming if there's lots of people around. If we're getting too much input, that can make it really difficult. An example that we can look at that sort of can show how we can have this loss in our brain function and not really be aware of it is a really simple test that shows something that's called hemispatial neglect. It just means that we miss half our brain. So this is you'll understand why. This is the clock, house, cat test. And what we do is we ask people to copy the picture of the clock and the house and the cat. So you can see what happens when someone has damage in their parietal lobe. That's usually where this sort of effect happens, because that's one of the places that we take in lots of information, we put it together. So if I ask someone to do this and they produce the drawing, where you can see that the clock's missing half of itself, that the house is missing half of itself, that the cat is missing half of itself. Now, if you've got hemispatial neglect and I give you this and you draw those pictures and I say, now, are they exactly the same? You go, yep. But if I say, what about this bit here? It looks like there's nothing there. So I actually draw your attention to the bit of the clock that's missing numbers. You'll say, oh, there's some, yeah, there should be but you probably won't be able to recognise what numbers should go there. We often don't realise what's not working until we have to use it. That's really hard. The other side of what makes it really hard is all the people around us can see what's missing before we can. And they tell us, and we get shitty with them. Well, maybe. Real shitty. We'll talk later. So one of the things that's important, and it's really frustrating, is trying to have a balance of good communication. So that if people are consistently telling you things, you can just try and go, okay, well, I don't necessarily agree, but I won't argue as much about it. But it's really hard to believe something about yourself that you don't feel or see. So it's important to remember that, and this is why it's so hard, because we do get into big rows with each other, particularly about driving, because there's a difference in what we're perceiving. When the brain's not working properly, we're often the last ones that notice. It's a really tough thing to remember. So how do we believe other people? We don't necessarily have to believe them. We just have to follow, okay? And come to an agreement and try and remind ourselves that they actually don't hate us so much that they're banning us from doing the one thing that gives us independence. They're actually trying to keep us alive and safe. But how do we care for ourselves when this is happening as well? Because we're telling you you've got brain cancer. If you've got treatment, if you're having treatment, then you certainly agree. If you've just had surgery, yep. But a lot that happens afterwards just leaves you feeling pretty shitty, but not really knowing what to do. And so one of the simplest things, and this is where you get to go, man, I don't know why I come to these days. It's all bad news. The best thing you can do for yourself is to exercise. Right, that pisses me off too. I'm really tired, it's cold and it's raining and I don't want to exercise. But we know that what can help with exercise, it works on multiple levels. From my perspective as a clinical psychologist, it's better than giving you antidepressants. All right? We know that it helps us to feel better in our head. I know we're talking about our head today. But we also know it reduces fatigue, which I believe is further proof that there's some kind of divine being with a very strange sense of humour, because I'm really tired and I don't want to do things and you're telling me exercise will help. Yeah, that's fine. Thanks for that, Cath. But it can also reduce the toxicities of some of the treatments that we're on, and it's those toxicities that are the things that make us feel lousy. It can actually help us to get through treatment, to suffer a bit less, but to also recover faster. And we've actually got some evidence that's coming out now that's suggesting that it has a survival benefit. So that actually makes it pretty important. I think if we could prescribe exercise, we would. We do prescribe it, but it's one of those prescriptions that you go, yeah, look, thanks for that. I might come to it later if I need it. So one of the things I would say, both for patients and carers, is get yourself out trying to do something. Try and find the ways that you can feel better. If this improves that cognitive fog, so you're not quite as, don't really know what's happening in the world. It lifts our mood, it improves our sleep, but it also helps make those new connections so the yellow bits can talk to the yellow bits again. It helps with that plasticity. It helps our brain to work on making those fixes, which, yes, are always slightly dodgy, but they're fixes. So don't underestimate how important it is. You don't have to be happy with exercise to do it. You just have to do it. Exactly. And look, I'm also going to talk quickly to the carers, because you guys actually have a really important role as well, and it's often in ways a more difficult role than being the patient. Because when you're the patient, we give you things to do. We operate on you, we give you all sorts of, do this, do this, do this. And when you're the carer, we say, we just want you to watch someone you love suffer, okay? Yeah. I've been a carer, and this is a picture of my beautiful brother-in-law and sister-in-law. So Peter had advanced lung cancer and he died in our house at 55, and Lynn had metastatic breast cancer, which went to her brain eventually, and she died at 50. We focused in our family on trying to have good times, as you can see. Often that involved alcohol and gumboots. perhaps not the most sensible combination, but look, self-care for carers is really important, you know. And was I good at looking after myself when I was a carer? No, I was terrible, but I knew all the things I could be doing, and very occasionally I did them. It's really difficult to care for someone that doesn't feel like they need the type of care and support that you're giving, and that's frustrating. We've touched on that. And it means that we can experience this emotional exhaustion. We can burn out. Because we're watching someone suffer, we can't fix it. We're trying to make sensible suggestions as to what they could do, and they're telling us where we can put our sensible suggestions. So as carers, we really need to look after ourselves as well. We need to have some time out, okay? But we can also do things together. So one of the things that Lynn and I did really well was we napped together, okay? When she went down, I went down, and no one disturbed the house. But we can also, you know, look at some options for respite. And respite doesn't have to mean going to a strange place where you don't know people. It can just mean other people coming in and spending time.
A trip to Hawaii.
A trip to Hawaii? That sounds...
For the patient.
Yeah, no, for the carer. We should have a little cruise just for carers. Sorry, patients. But also think about accepting help. If you think about someone you love that's really struggling and you have the opportunity to help them, how nice does that feel? You know, it's always nice to be able to help the people we care for, except when we're the ones that need help and then we go, no, we're fine, thanks. So there's all these people out there that are desperate to help us who we have the opportunity of giving that beautiful gift to, and we go, no, it's all good, thanks. So try not to be that person. Try and let the people that care about you and care about your family. And sadly, carers, exercise is just as important for you. So one of the things that you can do is try and find one of the rehab gyms and go together. Go for walks together. Do little things together just to try and both encourage each other. Okay, I don't have a golden wand, but honestly, if we can try and focus on these two things, which is finding the things that we can do together and doing them and trying to enjoy them. And so if there's danger in doing things together, like, you know, let's both go for a ride on electric scooters. Oh, you know, I don't know that that's such a good idea. Avoid those ones and try and find things that you can do. Make sure you spend time with family and friends. You know, one of the most amazing things we did was go to Dreamworld 6 weeks before Lynn died, and I paid a fortune for an extensive suite of photos of us on rides, and I look like I've got an intellectual disability in every single photo. She had a great time, and she loved those photos. It is about making memories, but it's also about letting yourselves be sad. Because no matter what the outcome is, this has changed your lives forever. And it is just about acknowledging that. And one of the things we're terrible at as Australians is crying together. We cry apart if we cry at all. Share that grief. If, as adults, we can teach our children that it is normal to cry when they're sad, that is the greatest gift we can give them. So please, this is a great place to cry because everybody's looking forward, so no one except me can see who is crying. And I'm not giving that away. And sometimes it might mean visiting with someone like me to talk or reaching out to some of the stuff that Frances K. Lampkin's talked about this morning. But don't be afraid to just reach out for support. But also do things apart. You need to have time apart with family and friends. You know, you need to set aside time to rest. We weren't allowed to have rest time with Lynn. We had a little sign that we put on the front door that said, "Gone shopping." That was, people wouldn't knock and she would go to sleep. But making sure everyone's needs are met as individuals is really important, you know. And again, visiting the psychologist, a lot of the work that I do is actually with carers. Just finding some support, working with families, just adding in that level of someone else with a pair of eyes that's separate that can make suggestions. I'm done. Thank you. I think it's your turn, Mike.